Health Chat is sponsored by Buell Regional Health Foundation.
Many lessons we've learned since the acute phase of the pandemic, one being how important movement is. One of the lessons we haven't learned yet, though, is how important safe movement is. So kids should play sports for many different reasons, not just movement, but social interaction as well. We learn how to play by the rules, we learn how to play with others, and we learn how to be disappointed and excel all through the sporting activities.
Sports are also important for developing coordination and balance and strength. It's great for cardiovascular endurance to help reduce the risks of childhood obesity. As Allison touched on, it's great for mental health to reduce anxiety and depression. It can help develop skills to be active and maintain that active lifestyle, hopefully throughout your life. A lot of children don't have the appropriate gear that they need to keep themselves safe, whether that be the appropriate shoes or whether it's the appropriate, if it's football, the appropriate helmets and pads. And some of our coaches might not have the training or the education they need to keep those children safe, and also children are kids, so they don't have the knowledge yet to learn what they can do to keep themselves safe during the sports. And so they're going to rely on those adults, those coaches, and those family members to help teach them that. A lot of the injuries can occur, like I touched on earlier, that if the child doesn't have the appropriate equipment, they could be not trained appropriately for the sport. So if they are playing a sport that has a certain level of cardiovascular endurance that they should have, and they haven't done any training or cross training, they might not be ready for that sport either.
I would also say that kids interpret injury differently too. So sometimes something could be really painful or bothersome, an indicator that there's an injury there that a child just doesn't recognize. And so sometimes we don't learn about injuries until later on past that acute phase.
There's a lot of key factors that I think are important to touch on here. I think that the appropriate training for our coaches and the family members of the children are important. So ensuring that the children have the equipment that they need that I touched on earlier, ensuring that the coaches are trained so that they can teach the children, for instance in football, how to tackle appropriately. So if you're going to tackle, there's a certain way that they should do that, and if they're not trained, they can injure themselves or their peers. You want to make sure that the playing field is safe, so there's no hazards there. That needs to be checked out. Sports physicals are important, so ensuring that every child has that physical, that they're cleared for physical activity, and then they have a baseline for where they were prior to injury as well.
I also think it's important for kids and families to create routines and safe spaces. So checking in with them regularly before and after a practice. How are you feeling? How did it go? Was there anything significant that happened during practice today? So having those conversations with children to let them have that space available to start talking about, oh yeah, maybe I did experience a pain, or maybe I felt out of breath, or maybe there wasn't something right. But they're not naturally going to just give us those pieces of information. So finding ways that we build habits to bring those out every time.
And rest is also important. So if the child has received an injury, you want to ensure that they get the appropriate amount of rest that their body needs in order to heal. So you might need to look for those signs that Allison mentioned, if they are holding a certain part of their body, if their technique changes, if they're a football player and their throw all of a sudden is different than what you're used to. You might need to talk to that child and see what it is that's causing that pain, and encourage rest and making sure that they get appropriate amount of rest so their body can heal so that they can return to play sooner. Nutrition and hydration is also equally as important. Ensuring that they have a well-balanced diet, fruits, vegetables. You want to encourage lean proteins. Meals, having you want to have a routine, so they want to have a certain amount of meals every day and try to stay in that routine as well. And hydration, so you want to ensure that they have, before, during, and after all sporting events, that they have appropriate hydration to reduce especially heat-related illnesses. So some signs of a concussion can include if a player, their personality may change, they may slur their speech, they may appear dazed or confused. Typically, if they they're not familiar with something that they should be aware of, for instance, the score of the game or who their opponent is, or if they are all of a sudden confused on the rules of the game, something that they've known all the time. You may see changes in personality after a concussion as well. And some symptoms that they may report to you could be headache, nausea or vomiting. Dizziness is common. Loss of consciousness can occur with a concussion. Just general changes in emotions and the way that they're feeling can also occur with a concussion. Changes in balance, coordination, things like that as well. It's important to make sure that they receive medical care if a concussion is suspected. So immediately remove them from play and make sure that they're screened by a medical professional. If they can have a pre-concussion screening, that's great, but not every sports team has ability to do that. So just trying to make sure that they're screened prior to returning to play. They're not allowed to return to play until it's deemed that they have not had a concussion or that they've received the medical treatment necessary.
And I think it's really important to, again, include that conversation with your child. So it's not just looking for those signs and symptoms post-hit injury fall, but also talking about those signs and symptoms throughout. Some of them emerge a little bit later when we start to notice things like lack of concentration or hypersensitivity to light, sleeping too much or not sleeping enough. Sometimes these are symptoms related to the concussion that come out maybe 48, 72 hours later. So just being really diligent about tracking what are they feeling, what are the symptoms that they're experiencing, how are they acting different or showing some signs of distress.
We've touched base today on why it's very important for kids to be active, why it's great to be involved in sports to just improve their general coordination, balance, and strength, as well as mental health and their ability to interact with their peers. Sports injuries are on the rise, and so there are a few things we've shared that you should hopefully be able to use to help reduce sports injuries for both parents and coaches, as well as the athletes.
We want to be sure that we are having equipment that is fitting properly, that we are creating routines that support the health and wellness of the child, both before, during, and after participation in this movement and sporting activity. And we really want to be sure that we're looking for some of the more significant injuries, such as signs and symptoms of a concussion, and ensuring that we are following up with medical professionals and making sure that the child is recovering fully before returning to play.